IVF is a 50-50 thing. So it's not God still has a final say.
Absolutely.
Because once we implant into the uterus, our hands are off. So what is going on inside the woman's womb for the whole of that 14 days, we don't know. Exactly, because when a couple, you know, or partners that have been having sex for 1 year, unprotected sex, let's say it like that. Unprotected sex for 1 year, and they've not taken in, they've not conceived, then we consider it as primary infertility.
I like that.
That is if they are actually looking for a child.
Okay.
Yeah.
Wow. So if you're married for 1 year and you haven't conceived and you're not sure what's going on, the advice is to go visit
your gynecologist. For proper evaluation.
I like that. Yeah.
When the fallopian tubes are blocked, so the final thing the gynecologist tells you is to go for IVF.
Okay.
Because you know fertilization occurs in the fallopian tube, normal sexual intercourse. So when those tubes are blocked, that means fertilization cannot occur naturally. Do you understand?
Wow.
Okay, so that one is one of the main factor why people go into IVF.
Okay.
And it's a major problem.
Wow.
Yes.
Wow. So that's it, people. If you've been married 1 year and you haven't conceived and you want to conceive and you are not on any birth control medications, please go visit
your gynecologist.
Ready?
Yeah.
Okay. Hello, welcome back to my channel. If you're new here, make sure you subscribe, hit the subscribe button, turn on the notification bell so you don't miss any of my videos. Today we're going to be doing something very exciting. I have started a fertility series here on this channel, and today I have a very special guest with me that would be talking to us about fertility, something very important in fertility, and that's IVF. I can't wait for you to meet her and enjoy this video. This video is a 3-part video, so make sure when you're done watching this, you watch the next one and the next one, and make sure you share this video. Let's get started. So now, let me let you meet my guest. So what is your name and what do you do?
My name is Ezekwe Joma and I'm a nurse, a fertility nurse.
Wow, that's amazing. And how long have you been working in the fertility field?
Okay, this should be my 3rd year in fertility. Yeah, I started working in 2019.
So let's get started. So what is IVF?
Okay, IVF, the full meaning of IVF is in vitro fertilization.
And what is in vitro?
Okay, in vitro means outside the body.
Wow. So that means fertilization that occurs outside the body is called in vitro
fertilization. So in vitro it's outside the body, while fertilization is now the sperm or the semen fertilizing the egg. This is outside the body, because we know the normal way of, you know, the whole sexual intercourse thing. It's, you know, a man and the woman meet, and then millions of semen or sperm, you know, runs into the body, and they start fighting to meet oocytes or an ovum, yeah, which is the egg of the male, and then fertilization occurs in the fallopian tube.
Wow.
But okay, so in vitro fertilization now means an assisted reproduction whereby a woman's egg is retrieved from her, then the sperm, the man produces his semen, and both of them are placed inside a dish. Then after 3 to 5 days of fertilization, the woman is called back to the clinic.
Okay.
So that the embryo, now remember it's now an embryo.
Because it has fertilized.
Yes, because it has a fertilized. So once it fertilized, it becomes an embryo.
Okay.
Do you understand? So the woman is called back, and then the embryo is placed into her womb.
Wow.
Like the part of the womb is called endometrium.
Okay.
Yeah.
Wow, that was a lot. So we're going to go in and talk about the processes.
Yeah.
And I like how you've kind of like started in the processes.
Okay.
So viewers, you've seen where fertilization that is natural is the one that you were talking about, normal intercourse, or that fertilization happens inside the woman.
Yeah.
While in vitro is something that is occurring outside of the woman and the man. That's amazing.
Yeah.
Thanks for making it so simple
You're
for us.
welcome.
So let's go to the next question. The next question is, when should couples start to think about IVF?
Okay, there's no particular time. You don't need to, waste time to, start considering IVF. Okay, so a couple is given at least 1 year. Do you understand?
Okay.
To conceive, and when they don't conceive, that means they've gone through the whole gynecological evaluation. Maybe they've seen their gynecologist and they've done series of tests. So it can be the woman's fallopian tube is blocked, the man's sperm is low, and then the doctor now tells them this is the final, you need to go consider IVF. So there's no particular time for it. So once your mind is made up for it, you don't need to waste time. You don't need to wait for age to catch up with you. Then you consider IVF, then you move in and do it. So there's no particular time for it.
Okay. So you mentioned a lot of different things in that. You mentioned that when a couple has been having regular sex for at least 1 year, that's when you call them infertile, or that's when you are encouraging them to start seeing a doctor, a gynecologist, to evaluate their fertility.
Exactly.
Okay.
Because when a couple, or partners that have been having sex for 1 year, unprotected sex, let's say it like that. Unprotected sex for 1 year, and they've not taken in, they've not conceived, then we consider it as primary infertility.
I like that.
Do you understand?
Okay.
So at that point, we advise the partners or couple to visit a gynecologist to know what the issue is. That is, if they are actually looking for a child.
Okay.
Yeah.
Wow. So if you're married for 1 year and you haven't conceived and you're not sure what's going on, the advice is to go visit
your gynecologist. For proper evaluation.
I like that.
Yeah.
Because then the whole end product might not even be IVF. It could just be
exactly
fallopian tube blockage. What else have you guys seen?
So it can be endometriosis. Let me just talk about medical jargons and all that, but there should be something. It might be hormonal problems and it just needs to be corrected. It might be fibroid. It just needs to do a surgical structuring to just put everything back to place. It might not necessarily be IVF immediately. So it just to be evaluated. Fallopian tubes being blocked. Okay, so when medically, when the fallopian tubes are blocked, so the final thing the gynecologist tells you is to go for IVF. Because fertilization occurs in the fallopian tube, normal sexual intercourse. So when those tubes are blocked, that means fertilization cannot occur naturally. Do you understand?
Wow.
Okay, so that one is one of the main factor why people go into IVF, and is a major problem.
Wow.
Yes.
Wow. Thank you so much for sharing that and helping us expatiate on that. So that's it, people. If you've been married 1 year and you haven't conceived and you want to conceive and you are not on any birth control medications, please go visit
your gynecologist.
All right. So how long does the whole process of IVF take from the beginning to the end?
Okay, so let's say it lasts for a month and 6 weeks. Sometimes it's lesser than that. Sometimes it's approximately 2 months.
Okay.
Yeah.
That's really short.
Of course.
I actually thought it's longer than that.
No, it's not a big deal. It's not really a big deal,
Wow.
Yeah.
Just 2 months. Wow. All right. Okay. So what does the process entails?
Okay. There are different, processes, so I'll start by the first one, which are the medications, oral medications. Medication is given to a woman to synchronize her cycle. you understand, to control her cycle, you know. So when she stops that drug, her period comes, and then we move over to the next medication, which is taking injections. So these injections are hormonal injections. Okay, so these injections makes her eggs to start growing. You know, the usual thing is during ovulation, the brain sends signals to the reproductive system, it's time to ovulate. But this time around, the medications are doing that.
Wow.
Yes. Okay. So the woman takes the injection for like 11 to 12 days. And during the period of taking the injections, she'll be coming in for scans. During the time of the injection, she will need to come and do some scans to know how she's progressing, to know if the eggs are actually growing. Okay, so after the 11 to 12 days, we give her the final injection. So that particular injection helps in the final maturation of the eggs. Okay? Okay, so after which she is called into the theater for us to retrieve the eggs. Restroom to empty her bladder, so we don't puncture the bladder while retrieving her eggs. So when the eggs are retrieved, so in a laboratory, the man now produces his sperm.
The man has to be in the laboratory to produce that.
No, the laboratory is very sterile, so we don't allow people to just enter there, so they don't contaminate what we are doing. Okay. So the embryologist is in charge of the laboratory. So the man outside the clinic, inside the world, in the comfort of his home, produces his sperm and then brings to the clinic.
So you just talked about evaluation and then medication and then retrieval, then fertilization. Then what's the next process? Okay,
so within the 3 to 5 days, the embryologist, you know, keeps on checking. Once the fertilization occurs, let me say this, it becomes an embryo.
Yay!
So the egg and the sperm coming together, it becomes an embryo. It's now called an embryo. Okay. So the embryologist keeps checking on the embryos to know if they are doing well, just like checking on your baby.
Aww.
So at that point, the embryologist is taking care of the babies. So they keep checking on the babies, you know, to know if they are doing well, if they are going to survive. Okay, what day do we need to transfer back to the woman? Do you understand? So these are the what you consider before you transfer back to the woman. Okay, so after the 3 to 5 days, the woman is called for the transfer of the embryos into her uterus, into her womb. During the retrieval, her bladder should be empty, but during the transfer, her bladder should be full. Why? Because it helps us to see the part of the uterus where we are going to transfer the babies to. Okay, so this time around with a catheter, the doctor, you know, passes again through her vagina to her cervix and then to the womb with the aid of a scan.
Wow.
Yes, in the retrieval also we use a scan. Of course, you need to be seeing what you're doing. Exactly. Yes. And then also in the transfer, we need to see also where we are transferring the embryos to. Okay, so once we transfer back into the uterus, then we give some woman some instructions not to stress herself, not to have sexual intercourse within the period. We want her not to make sure that the IVF actually worked. Then she goes home. Then we give 2 weeks time off, then before she comes back for a serum pregnancy test to be done on her. So within that 2 weeks, she's not to stress herself, she's not to do her things, she's not to have sexual intercourse. She can even take off days from her workplace. That
so
will
you
help.
Recommend that she takes off days?
Yes, if she can take 1 week off or even the whole 2 weeks, depending on where she's working, she can take off and then rest for the whole 2 weeks. Then after 2 weeks, she comes back. So for us to do a pregnancy test. With that, we'll now know if IVF actually worked or did not work. IVF is a 50-50 thing. So it's not God still has the final say. Absolutely. Because once we implant into the uterus, our hands are off. So what is going on inside the woman's womb for the whole of that 14 days, we don't know what's going on there. God's hand is there, you know, whatever you want to think, you know. Yeah. So we on our own part, we hope that everything turns out well, because once our patient is happy, we are happy. So
I really like that part of faith you put there. So it's still ultimately up to God, right? Whether it will work or not.
Yes, it's God is the ultimate. He's the one that gives children.
Yeah.
He's the one that takes back. So I believe he's the one that gave someone this idea to start up IVF.
You're right.
Do you understand? Yes, he's the one that gives ideas to people. So without him, nothing can ever happen. Yeah,
I like that.
exactly.
So let me ask you this last question. So if let's say by God's grace the baby has implanted, you know, when they come back in the 2 weeks, they got a positive serum test, pregnancy test, what happens after that?
Okay, so if the patient comes back and then we get a pregnancy positive test, yay, everybody's happy, everybody's smiling and all that. We give her an appointment.
Okay.
Although we also give an instruction: don't stop your medication, your hormonal medication, keep on taking it until we tell you to stop it.
Okay.
And also we also mention to them that you don't just take medications like that without informing us. You inform us, the medical team, the medical professionals in the IVF, before taking in drugs. Don't just say, hey, I'm having headache, let me just go and take this, you know, headache drugs and all that. Always inform us, because it can tamper with all our procedures. Okay, so when this happens, she's told to come back in 2 weeks time. Okay, so once the woman comes back for the 2 weeks, you know, appointment, we do a scan on her. So we want to check if the baby is there.
Okay.
So we might even pick up a heartbeat.
Wow.
So once we pick up a heartbeat, everybody's happy. But then we give her another appointment. The appointment might be 1 month.
Okay.
So if she comes back 1 month, we do a scan for her again.
Okay.
And if she's doing well, fine, she registers for antenatal care.
I love that.
Yeah.
Wow, your process is a happy process. I love happy things. That's why I'm a midwife. Because it's all happy babies,
Exactly.
pregnant people.
Yeah.
Nice. That's amazing.
Yeah.
Thank you so much for sharing all this with us.
Welcome.
And my last questions today, by the way, guys, if you have questions for Nurse IJ, we actually call her IJ. Is it IJ or NJ?
Nurse IJ.
IJ. If you have any questions for her, go ahead and leave them in the comment section. She'll be reading, she'll be commenting and replying, you guys. Right? I'm kind of like asking her right on the spot. So make sure you leave them right there. And let me ask you, I have 2 more questions for you.
Okay.
What's the success rate in your center where you work?
Okay, remember I said IVF is a 50-50 thing. Okay, and then with the help of God, we've been getting, there's no time we do a procedure that we don't get at least 1 or 2. So even if we get a 1 positive, we are happy. Yes, but for the processes that we have, for the procedures that we had in time past, sometimes we have 50%, sometimes we have 70%, sometimes we have 20%, sometimes we have 10%, and we are all happy during all those times, because at least we are getting 1 person that will smile and go home.
Yes,
exactly.
Yes. So guys, if you want to reach out to her where she works, leave it in the comment and I will try to get that information to you guys. All right. And then our very last question is, what would be your advice for a couple considering IVF?
Okay, so my advice is this: don't waste time, don't overthink it, don't just can start thinking, oh, what will people say, what will happen if I do this. Just make that bold step. Unless finance is the problem, then you start saving up small. You can even collect a loan from the bank and, you know, come and try it. You know, you take risk in life. Of course, when you're looking for a baby, you also take risk. If it means getting a loan from the bank to start up the process, it's fine. But don't just wait till you get to an old age for you to, you know, start thinking about it. You know, once you are young and you really want to have a child, just go right into it.
So your advice is for them, don't overthink it, take a loan if you have to.
Yeah, take a bold step. You know, take a loan if you have to. Come do it. Just take that risk and, you know, come over and do IVF. I am waiting for you. Other clinics are waiting for you to come and try IVF, in vitro fertilization.
Love it.
Yeah.
Thank you so much, Nurse IJ, for sharing so much with us from your wealth of knowledge. We really appreciate you.
Thank
and
you.
We have so much more coming from where this came from. So guys, do not forget to hit the subscribe button, turn on the notification bell, leave your comment in the comment sections. What are your thoughts about IVF? Have you tried IVF? Do you know anyone that's tried IVF? And do you have any questions about IVF? Nurse IJ will be in the comments reading and replying you guys. And in our next video, we'll be talking about some myths about IVF. So make sure you stay tuned for that. Until next time, stay blessed. Bye. Thank you so much.
How do you do this? Stay on the AC. This place is so hot.
So sorry.
Wow, this thing takes a lot of time.
It does. I think we should.
Okay, you guys are cutting our video short, and I don't like it.
Okay.
Look at this one. Okay, so what was the question you asked me before that?
I forgot.
I don't remember.
Let me see. Did I write it down? No, it was.